form, we can measure these tools, if it is applicable and if it is utilized correctly or not. For example, the psychosocial assessment usually done by nurses. But when I will ask the staff nurse what meaning of that or this, they didn't have any. So they need to understand the intent of the assessment tool that use it with them with their units. Let us see the next standard. Again, this is about the assessment, initial assessment. And now this standard PC7 will extend from general assessment to specific assessment for patient on pain, or patient they have functional limitation, or patient at risk of malnutrition. So in case of one of this case, we need to extend the assessment, and we need to do additional referral for this type of patient. So the standard PC.7.1 hospital implement policy, again, that define the criteria and the process for screening patient for pain, function limitation, include risk for fall and malnutrition. So within the initial assessment policy, we should to have this as a part. Second, for PC 7.2, the screening criteria are developed by qualified individual. We mentioned that if something related an additional assessment, so the dietary department supervisor should be included within this policy deployed. Then PC 7.3, when pain is present from the initial screening, the patient receive comprehensive pain assessment. Actually, we will have one part within our presentation today about the standard related pain assessment and pain management, but this is the first standard related to pain. So as soon as the patient in pain, we will do initial screening, then we will do comprehensive pain assessment and pain management. PC 7.5, patient identified as malnutrition or at risk for malnutrition are referred to nutritional assessment. Within the initial assessment policy, it should highlight it, how this referral process will done. It is by calling the dietitian by phone or by sending referral form or whatever. So it should be included in the policy itself. That's why, again, as evidence of compliance for this standard, we need to have first policy that describe the patient assessment within admission. Then we need to have also pain assessment or pain management policy. We hope to have separate policy for pain assessment and management, and reflection of this or implementation of this policy should be within the medical record, patient medical record. So we should find out that there is special screening for a patient in terms of pain, function limitation, especially high risk to fall, plus malnutrition. And this should be part within the initial assessment form upon admission to the unit. Then, if patient identified at pain, should be from initial assessment or initial screening should accelerate the process to do the full assessment of pain, and the patient should receive patient management. If patient identified as malnourished or at risk of malnutrition, again it should be clear process for referring this patient to qualify nutritionist or dietitian. Now, we need to find out within the patient medical record there is referral form or there is full assessment done for this type of patient upon screening by the nursing staff. Now, for the standard, again for initial assessment, this is standard PC9. It's about initial assessment of patient is completed and documented in the medical record on timely manner. That means as soon as mentioned by policy, the patient should be assessed and it should be documented in the patient file. So PC 9.1 is the hospital implement the policy that defines the time frame for completing the medical, nursing and other assessments required for different care setting and services. Now if we are talking about nursing, okay, so the initial nursing assessment, it should be done as soon as within the end of the shift. Okay, so it's mentioned in BC 9.2 that the medical and nursing assessment are completed and documented within the first 24 hours of admission for routine elective cases. While in BC 9.3, the medical and nursing assessment are completed and documented early whenever indicated by the patient condition and the hospital policy, such as in case if the patient for emergency ER or admitted for emergency department or emergency operation will done for this patient, or the patient in critical area. Now BC 9.6 medical nursing assessment are complete and documented for all patient prior to surgery, anesthesia or invasive procedure. So again, this standard can be reflected within the medical record, and we should ensure the following. First, the medical record of different patient category and observe the difference between when the patient admitted to the unit and when the nursing assessment completed for the patient, if it is fulfilled with the hospital policy or not. And for example, for elective admission, it should be within 24 hours. For other units, as soon as mentioned by the hospital policy. And in case if this patient will send for surgery or for invasive procedure, the nursing assessment should be completed and documented within the medical record. Now, again, nursing assessment. Now, it is PC chapter, but it is more about nursing assessment. It should be completed and documented for each patient. All patients admitted within the hospital should done for him or her the full nursing assessment. Now, who will do the nursing assessment? As mentioned by PC 11.1, it should be performed by staff nurse, qualified, competent staff nurse. BC 11.2 is mentioned that the nursing assessment identify the patient nursing need. So I can find out what is the need for this patient, so I can develop or create my nursing care plan as soon as I finish my assessment. Now BC 11.3, the nursing assessment must be that timely and complete. What is mentioned by hospital policy? It should be implemented in terms of time when they should complete the nursing assessment. BC 11.4, the nursing assessment is documented in the patient medical record. Now, if the shift will finish and still the nurse not able to document the patient assessment, that means it's not done. If it is done in separate paper, not in the medical record, that means it is not done. Again, how I can ensure this?